going on? It's after work. This is Patrick. It's about 5 o'clock at night. I was pretty much done with work at 4, but I volunteered to go run some supplies out to somebody who needed like a wheelchair and a shower bench and a commode and stuff like that. I'm actually kind of surprised I fit all of it in my car. I had to put the shower bench in the passenger seat, but I somehow managed to pack it all in there. It's a really rainy day today. I don't know if you can hear the rain, but it's tough like driving around and visiting people's homes on a rainy day because the weather just makes me want to sleep, you know, or read a book or something. I didn't really have that effect in the nursing home, probably because it was so, it was probably designed to be kind of insulated from the elements, so I didn't even realize it was raining when it was raining. This is one of those overcast rainy days. I like days like this. They just make me really tired. And the fact that my sleep schedule is still messed up from that overnight shift probably doesn't help much either. So one of the things that came up today was when to withdraw unnecessary meds, or at what point do some meds become unnecessary. I kind of got put onto this task by the case manager of one of the patients that I was seeing in her place. I was filling in for it, and the patient had been really nauseous lately, and his blood pressure was low. And looking at this person's med list, they were on 4 different antihypertensive medications. Now, those of you familiar with antihypertensive regimens, listen to this and tell me if this sounds excessive to you, right? Diovon, 160 milligrams POQD, Norvasc, 2.5 milligrams POQD, lisinopril, 2.5 milligrams POQD, and metoprolol succinate, 25 milligrams POQD. That's a lot for a relatively old guy, and his blood pressure was low anyway, and every time I see him, he'd be like, why do I have to take all these pills? Do I really have to take all of these? And today I was finally able to say, no, you do not. So in addition to 3 out of those 4 antihypertensives, I also got discontinued the ferrous sulfate iron supplement, the Magesterol appetite stimulant, the baby aspirin every day, and a few other things too. So he was pretty happy with that because he'd been wanting to thin out his med list for a while, so I was glad I was able to accommodate him. And the smile on his face when I showed him what his pill organizer looked like now was reward enough. It did take leaving and coming back because at the time that I was with this person, his doctor's office was out to lunch. I don't know if you've noticed this, but doctors' offices tend to just shut down between like 12 and 1:30, they like don't even take any calls. That must be really nice, just for an hour and a half a day. Oh, sorry, we're not doing anything right now. It's a very European mode there. That'd be nice. I also got to catch up with a patient I had not seen since admission, and that was really nice, kind of catch up on how things were going, and they were really happy to see me, and the family was really happy to see me, so that's kind of cool. A lot of the time, I was just reflecting on this the other day, a lot of the time I only see people at the beginning and the end, because I do a lot of admissions and I do a lot of pronouncements. But I'm picking up a lot of day shifts this week and next week. Almost every day I'm working, so that'll be nice. And then I'm taking the weekend off to see the Secret Chiefs 3 perform in Milford, I think. So that should be cool. I've never seen them in concert, and the violinist from Stratosphere is going to be there, so pretty pumped about that. If you don't know what bands I'm talking about, just look them up on YouTube. They're pretty neat. Yeah, Western Civ continues to be a very, very boring class. It's another one of those classes that looks like it's only going to require an hour's worth a week of my time, which is kind of a jip because it costs, $1.5 grand to take. I was asking our clinical director some questions about anticholinergic drugs for terminal secretions given in the nursing home, and I kind of ran by her a situation that I ran into where somebody who was not responsive or conscious at all, not responsive to pain or anything like that, they were giving her this powerful, long-acting anticholinergic drug, glycopyrrolate, every 6 hours around the clock. 12-6, without fail. They were loading her up with this stuff. And yes, her respirations were quiet, but her tongue was dry and blistery, and there was orange patches all over it, and like all of this stuff, and no matter how I phrase it, everybody of course is going to swear up and down to me, say, oh yeah, we do oral care every hour. Sure, yeah, we do oral care every hour, definitely. But when I ask why there's no oral care supplies set up at her bedside, it'd be like, oh, well, we're not allowed to set up supplies at the bedside. So I'm like, not only do you claim that you're doing this every hour, but you're making the nurses' aides who are doing it run back and forth to the supply, wherever the supplies are kept each time. It just makes more sense to just, leave the oral swabs in the room next to her. They're single use, throw them away. It's not like somebody else is going to use them by mistake. So my question to this, this one of my elders and betters was, would that situation warrant making a recommendation in writing to back off on the Robenal? And she said that yes, she thought it did. To just, try skipping a dose or two and see if the noise comes back. But this all comes back again to the idea that the only reason it's being given is the noise. And that noise is not bothering this person that's unconscious. It's bothering the nurses' aides and the nurses, and they don't like it. So they're giving a powerful, long-acting anticholinergic to make it go away. And, I'm working my way up to being a little more heavy-handed about recommending that people stop using those. We'll see how that works. Because really, there's that, risk-benefit. What's happening to the mouth versus what's happening to your ears, I don't know. Yeah, I really like driving in the rain. It's a lot of fun. It's kind of like playing a video game. You gotta pay really close attention to make sure you don't slide off the road. It's kind of cool. I feel like I organized my visits very, very well today. I feel like I got everything done in a really sensible amount of time. I think most of the visits were in a town that was kind of far away, but one of them was right near my home, and I knew that later in the afternoon was where that patient is used to being seen. And had a Spanish-speaking patient again today, one that I know fairly well, and we've kind of got a good communication rhythm going because he understands English but doesn't speak it, and I neither understand nor speak Spanish, so that's always kind of fun. And this person's wife was cooking this delicious smelling dish in the kitchen. It was making me so hungry while I was sitting there. And when I told the guy how lucky he was to have a wife who cooks such good smelling food, he broke out this big grin, and he was kind of nodding in appreciation, It's kind of nice. It would be interesting to visit some people of other ethnicities. I did visit a couple of ethnic Chinese folks once, but that was in a really extreme situation. I only had one visit with them. I haven't visited any Muslim families yet. I know they're around this area. I just haven't visited any of them. I have visited a fair number of Jewish families, but not really what you would call super Orthodox Jewish people or anything like that. Not to the point where they have the special post-mortem ritual care needs and stuff like that. Yeah, it would be interesting to visit some more ethnically diverse people because, I don't know, I just think it's interesting to get to know them and see how their families work and stuff like that. Yeah, I've pretty much abandoned looking for another job right now, even though my current job is only per diem right now. I hate applying for things. It just really irritates me. So I'm getting lots of shifts with my current agency right now, so I'm just gonna keep doing that. And I really like this agency too. They're like a non-profit. I'm kind of proud of their mission and everything. Well, nothing too exciting going on today, so yeah, maybe it's the weather. I just want to skip documenting and just curl up into a ball. Maybe I'll do that. Take a nap first and then document later. Who am I kidding? I'm going to document right away. Alright, I'll see you next time.